So I'm Kent Gerber, I'm the librarian. I sent out different notifications in email and some mentions, and Laura contacted me, and Kelsey did as well, and submitted some pictures, which are already up in the collection now. So thank you for your inside look into what you're doing. But then Laura said, we really, as a faculty, we're talking about how exciting it is to talk about our collective story. So that's where we are. Some of the questions I had, and you don't necessarily have to go with these, but how have things changed for you as teachers? How have things changed for you as clinicians? And I guess there's anything else, like, your people, families, like those other things. But I've certainly had sort of the teacher element, the clinician element is one that, like, how have you been impacted, personally and as a group? So I guess I'll leave that there. That's the setting. Yes, Amy?
Yep. So I think what would be great is maybe as we move into the questions, we could start by having each member of the nursing department introduce themselves, tell us just very briefly what they teach, their context. And then as we ask questions, if we could maybe get, one or two people to respond to each of the questions, and then that should make for a nice conversation. So if we could start with you, Laura, and then we'll just kind of go around. Maybe Laura, and then Tara, and then Emily and Kelsey.
Okay, I'm Laura Nugteren, and I'm one of the full-time faculty in the nursing department. I teach med-surg, and so I usually teach juniors. They're taught med-surg, but then also teach a clinical for our senior team. And so this semester I was actually teaching 2 clinicals, both on a cardiovascular surgery unit, with a set of juniors and a set of seniors.
Great. Tara, you want to tell us about you?
All right. So my name is Tara Cheath. I'm an adjunct at Bethel. I'm also in the grad school nurse educator track too. I also work part-time at Unity Hospital in the float pool, where I'm pretty diverse and work in all departments. Besides that, I have 3 kids, and my husband also is a nurse practitioner, so very busy. So I taught, this is my 2nd year, so I taught med-surg 1 and 2, and then this was my first semester of mental health, and that converted to obviously distance learning in the middle of the semester. So that is me.
Emily?
All right, my name is Emily Conrad. I am very new to the Bethel faculty. I just started as an adjunct this past fall. I have worked in the intensive care unit for the last 17, 18 years, and then had my master's in education and wanted to come back and just start teaching clinical. So I am probably the newest person to the team. And so, yeah, I feel like it's probably been the biggest learning curve for me, just because I hadn't had a ton of experience with teaching clinicals or doing any kind of distance learning. So I taught clinicals for junior students both this past fall and then this past spring. So besides working for Bethel and being an ICU nurse, I also have 3 children.
So my name is Kelsey Curtis, and this is actually my first year as a full-time faculty at Bethel. I was adjunct last spring and then came on as full-time in the fall. I teach juniors mostly in the fall, and then juniors and seniors in the spring. So I also teach in the med-surg clinical, both fall and spring, and then in the skills course for both fall and spring, and also for seniors. And then I work as an administrative nursing supervisor at Hennepin County Medical Center. And I have been casual, and prior to the pandemic, probably worked maybe 2 days a month. And since this has started, I've probably worked 3 days a week. So it's increased greatly. And during all this too, I have 3 kids, 5, 7, and 8. And so we are distance learning at home as well, which has been interesting. Yep, so that's my introduction.
Great. So we're just sort of wondering if you can offer some insights into how the pandemic has changed your practice as a nurse.
I think, as we were talking here, I kind of thought like, oh gosh, how did this happen? It happened so fast. So I remember the week before spring break, talking to the students about how we're going to transition and moving forward. And this was a big breaking point in their learning, where they really transitioned to practice, where they're taking care of more than one patient. And I just kind of think about how that changed them and my adjunct role, completely going from distance learning that nobody's really familiar with, but how my current practice as an RN has trained drastically. When you enter the building, you're wearing masks, you have full headgear and a mask on. And we do that to protect ourselves and our patients. I think it's kind of a different coming home, and what was I exposed to something potentially, and not wanting to give it to my own family, or if I stop and need to get gas. And so I after work change, there's like a locker room where we completely change our clothes. I bring an extra pair of clothes, come home and really shower for a really long time just to protect myself and my family. I think that's been the biggest thing. It takes so much longer to do a normal routine what it took, because for these standards of practice, we're following this to, like I said, to protect ourselves and our patients. So it takes a really long time to do a simple task with putting all this on and, leaving one area and going to another area. There's special rooms where we have to change our clothes and our mask and, follow those standard procedures, like I said, to protect ourselves. So I think that's been the biggest change in my practice.
I can go off of that too. So I think just about everything has changed since this pandemic has hit. For one, I don't think the general public or media really paid a lot of attention to what a nurse does until this really hit. And all of a sudden, everybody knows what PPE stands for, which was kind of an inclusive term in the hospital up until now. So there's a lot of fear and anxiety amongst nursing staff. I mean, and not just nursing, anybody really working in healthcare. It started out very, very, very scary. And I think that we didn't know, sorry, just a second. I have a child walking into the room. I apologize. So it started out very scary. And I think it has evolved into just 1 second, please. I will come get it in a minute. Okay. It has evolved into I think continued fear, but also a lot of burnout. And we keep talking about like impending surges. On my role as being a leader in the hospital system, we have been doing emergency preparedness. And prior to the pandemic, it was probably one slice of what we do in my role. And now it's everything we do. We're constantly talking about how we can be prepared, how we have enough supplies, how we have enough staff, how we have enough ventilators, and really managing that has been a big challenge, while also dealing with the kind of emotional roller coaster of that the staff and team is on. So it's, and like I said too, it's just been a lot of heightened anxiety and fear, and taking into what our culture is saying and what the media is saying, and then having to go live it out in practice, and always kind of anticipating, are we going to be next? Is this going to be, are we a New York or an Italy? And sort of managing that, but also trying to be prepared for that and not letting the fear overwhelm the work that we're doing.
Laura and Emily, did you want to add anything or build on anything that you heard there?
So I also work bedside ICU. And so seeing those very sick patients, I only do about 2 shifts a month. I'm a casual employee working overnights. I think just some of the very logistical things. And so we talked about the idea, a lot of people have heard about the idea of having negative pressure rooms and things like that, and that we're wearing all this equipment. But like as a nurse in those environments, like rooms that have been converted into being negative pressure, and you have these masks that have airflow coming through them. It is so noisy in those environments, even to be able to communicate between nurse and doctor, you know, in the same room if you have, you know, a crashing patient, or just like my ability to communicate with people outside the room if I'm staying in the room because I have all my garb on, you know, writing notes, you know, putting them up to the window, go get me this, tell my doc this, you know, like just that communication piece has changed, I feel like, a lot. My hospital has divided out into zones. And so like for our COVID positive patients, they live in the red zone. Our rule out patients are in the orange zone, our healthy patients are in the green zone. And so if like I'm in the red zone, I'm fully garbed the whole time. But then I can't access like where I get medications or where I get supplies. And so then people have to bring that to me. And, you know, it just really changes the workflow.
And at the same time that you all are doing this work in hospitals, you're teaching as well. And so how has the pandemic changed your practice as teachers? Emily, do you want to start? And then Laura?
Sure, I can start. I would say I almost feel like the pandemic has given me just more connections with my students than I thought, because I think as a practitioner, I'm figuring things out every time I go to the hospital and what's changed. And then I feel like I come back and I talk to my students and say, okay, here's what it was like in the ICU today. Here's what changed. Here was what like a COVID patient looked like. This is how things are changing for me. And I've been a nurse for a long time. And so let's just talk a bit about what that translates to you guys. And I think it's actually just created greater dialogue, because I feel like it's also placed me in the role of a learner, and also being new to kind of the education platform. I feel like it's a lot of learning for me, but I think in a lot of ways it also just gave me just a greater ability to connect with my students and saying like, you guys are learning how to be flexible with doing distance learning. Like I'm learning a whole new way of being flexible. And I think that's one of like the greatest strengths of being a nurse is like adaptability. I don't think that word has ever been so true in like what we do as a profession. And I think that has just come across just really strong in talking with my students of like, okay, here's how you learn how to roll with what's coming out, something that's new.
I just wanted to speak to the idea that, so we all teach clinical for junior med surg. There are 8 faculty that all teach on that team, and 7 of the 8 faculty that teach that on that team also have a hospital job. And so when we were looking at this impending, you know, pandemic, and looking at like what to do to, you know, our students got, you know, had to find an alternative way to meet these learning objectives for this course that was all supposed to be in the hospital that now we had to make out of the hospital. But we also, I think, really had to consider that 7 of the 8 of us also had a hospital job, you know, and what was going to happen with that if the surge came before, you know, the end of the school year. And so the idea of having backups and, you know, how we were going to support each other as faculty, in addition to supporting our ability to work in the hospitals and kind of support the general public, was definitely something that I think we had to take into consideration as a team and as a department.
So I also teach a skills course, which has been really a little bit more challenging. I think, well, it's all been challenging. The clinical courses, we've been able to really adapt and make some really good assignments that if we can't be in the hospitals at the bedside teaching them, which is what we would normally do for clinical courses, we've had some pretty good assignments that replace those. In this course, it's been a little bit more challenging because normally those courses are hands-on in the lab, and we are working with our simulation and with our mannequins and showing them this is a chest tube, this is how you care for a patient with a chest tube. And right now, since it's all virtual, we're trying to have them watch videos and show them things, and it's not the same as hands-on. And I think a lot of people go into nursing because they want a career that's very hands-on, and that's how they learn, is very hands-on. So I would say that course has been a little bit more of a challenge to have to teach all these very technical hands-on skills virtually. And so I've just found that to be a little bit more challenging than the clinical courses.
Well, what has been can you think of something that has been the hardest for you individually or as a group?
I know we've had discussions a fair amount of like how much we should be talking to our students about what we're experiencing. I think there's a couple different layers to that. One is that we don't want to frighten them, right? They're headed into this career. They've chosen this career based on an environment that wasn't a pandemic, and so trying to give them honest answers without creating an environment that's, scary. So really focusing on the positive, really focusing on people who are advocating. The other idea is that most of the time they're going to practice in not a pandemic. And so if we teach them things that are very unique to this crazy environment, we still really have to focus on the normal expectations and what things normally would look like and you would normally do, because that is the environment that they will normally practice in. And so really not letting this, completely scare how we're teaching them to practice, because things are so abnormal now. So really helping them to focus on that.
Tara, did you want to add anything?
I think really going off what Laura said. I know we had several meetings about that, and really like, what do you tell your students? And so kind of a struggle with that, but also like Laura said, some of the media is, really, really, kind of scaring the students and us, and kind of talking about that and what they see and how they feel. I just think my 2 clinical groups have shown tremendous resiliency. I think one struggle is it's hard for everybody. Everybody did not sign up for distance learning, and we all didn't sign up to be distance learning teachers. So I think it's difficult teaching in an online platform when you have a big variety of learners. And we all know that there are people that speak up and there are that won't speak up. So I think that's helpful. We've have like the chats, and I've opened up times where we can meet. And I think that's probably the biggest challenge, is the online platform and getting used to it. And I'm just so proud of each and every one of my students for being so resilient. And I'm excited to teach this new generation, and they have these strong qualities that I think are amazing. So I think this pandemic has definitely created some strong nurses, or we will be creating some strong nurses. So yeah.
Something that are some of the students that are on our Clarion staff, as they have been doing interviews over the last couple of months, is they always ask, well, what are the silver linings? And so can you offer what have been maybe some of the positives, or things that places you found joy, or what have just been some of the, moments of lightness or just value that you have experienced over the last few months?
Well, one thing that I've noticed is that after all this, I feel like we have endless content to teach. It sounds kind of silly, but for example, going back to the PPE, I always felt like maybe students thought that was a really boring subject in the fall, and putting on the gown and the mask correctly was like, oh, why am I ever going to need this? And I feel like after this pandemic, I'm thinking constantly of all of these great teachable things that have been highlighted through this pandemic, like the PPE and donning and doffing correctly. Like I said, it used to be a boring subject, and now it's going to be a lot more relevant. And I also think it's been mentioned a few times is the adaptability and resilience, because I think sometimes just we all get really focused on, you want things the way it is. You want to do everything according to Moodle, just how perfectly it's set up. And it's really teaching our students that, and us, that we have to be able to quickly adapt to things and adapt to changes. And really that's just the reality of the nursing profession, is things are always changing. I think we've all of us that are working in hospitals have had our pandemic prepared plans changed about 12,000 times over the last 2 months. So, and just like we're having to adapt to that, they're having to also learn to adapt and grow as adults and learners, that they have to change the way that they once thought learning was going to be.
I would say too, just the idea that we are so used to being able to control things. And so in this idea, we've mentioned the idea of there's so much fear, but I think the idea that, this has really been a time to control and to say that, okay, God, I'm here and I am here for you to use me how you want to. That I think oftentimes nurses refer to nursing as a calling, right? It's something that they've been called to do. And I was thinking, the other night I literally got called into work. It's like they literally called and said, can you work a night shift tonight? And, that's the voice. But also, God has called me to this profession. It's been difficult to maintain a hospital job and a full-time faculty job. I've, multiple times, debated if it was worth keeping. And so I'm like, okay, God, I'm here and I'm here for a reason. And, you just use me how you want me to. You've given me this knowledge and kind of this opportunity to be in these spaces. I repeatedly just learn so much from every time I go to the hospital. I'm able to bring things back to my students to kind of augment, what I'm able to teach, but also as an individual, to be that person that holds the hand, to be that person that says, you can do it as someone's, breathing at 40 plus times a minute, okay, we're just going to hang in there, and to be that person to offer just that moment where it's just you and them in the room. I think that, that's the silver lining. I think that's just that opportunity to be a nurse and, and then to have that help with being an educator.
And if I may interject, I was wondering if any of you would like to, on top of that, either silver linings or even just, Laura, you mentioned sort of how your faith is informing your practice and how you're making meaning and making sense of this. So I guess if any of the three of you could expand on either the silver lining or that faith element, how is that, how are you making sense of that right now?
Oh, go ahead, Emily. You can go ahead.
Kelsey, no, go ahead.
I was just going to say, I think it has been such for everybody, not just us as nurses, but for everybody, it's just been such a roller coaster of emotion and uncertainty and fear. And I think for me, what has been challenging in my faith is just hanging on to God's steadfastness throughout this, and that his love for us and not putting our hope and trust in him should just be the most unwavering thing throughout all of the uncertainty. And one thing that we haven't really mentioned, and I'll just briefly say that throughout this, as you've probably heard, but visitors and family members cannot see their loved ones in the hospital. And I think, we've always been taught as nurses to really always include the family and always have the family at the bedside. And since that has been taken away, I think it's been a challenge for nurses too, to really step into that side where we are, like Laura mentioned, the hand holding and being not just the nurse that's physically caring for the patient's needs, but also emotionally and spiritually, which I think has, for some people, been a really big growth opportunity in their own faith. And so I think for me, it's really hard not to have family there with patients at the bedside, but it's also provided an opportunity to give hope and reassurance to patients when they need it the most.
Tara or Emily?
Go ahead, Emily.
No, I think it's been interesting, the idea of walking into, for instance, just an ICU room where your patient is scared, and then truthfully, as a practitioner, you feel that same element of fear. And just even, I think for me, it's been just some very simple spiritual practices of like, what is like that one verse that I need to just have in my head? Like, you know, we think about things like Psalm 23 of like, I can't think about much else because my head is being squeezed like a vice because I have all this PPE on. And so all I can really do is take deep breaths and think like, the Lord is my shepherd, like, and I have everything that I need. And I can't tell you like how reassuring that has been for me when I feel anxious as a nurse, and then I want to do a good job of caring well for my patient. But just I think some of those simple spiritual practices of like breathing in like God's presence, and just saying just those simple phrases.
I did wonder, so Laura, I know you mentioned that as a group you have talked about, you know, this interview and your experiences. I mean, is there anything that we didn't cover with these questions, or were there things that you've talked about as a group that would be you wanted to share, or that other themes that we haven't covered that are important for people to know or for you to share?
I'd say the only other thing that all of us have in common is being moms, you know, so that idea of that we're homeschooling, that I have a protractor sitting on my desk, you know, along with my, you know, like clinical evals and stuff like that. And so trying to multitask that, and then also just working through the fears of our children, you know, that idea that, you know, mom's going to go to work. The first picture I had sent in was one in my full garb, and I shot that very intentionally to show my kids that, you know, look how safe mommy is at work, you know, to try to ease some of that anxiety for them. Yeah, that idea of, you know, that we all kind of had to transition, and, you know, how close do you stay, you know, the idea that I come home and I shower and I hope that I'm well. But there's always that, you know, period of like, okay, am I well? And could I possibly give this to someone that I love, you know, that I live with, my children, my husband. And so that piece of it, and just trying to kind of ward off anxiety for our own children. I mean, mine are 8 and 10. They know what I do. They know where I go. They know, kind of the risks that go along with that. They know that, you know, mommy showers right away, you know, and yeah, but I've also warned them from the get-go that we will probably get this, you know, that eventually, you know, we'll get sick to some degree, and that it'll probably be fine, and try to instill in them that idea of faith, you know, that idea of, you know, having, you know, faith that God has a plan for us in this, and, you know, but yeah. So I think the mom aspect is probably just the one more that, you know, with us. I don't know, does anyone else have?
It's not necessarily the mom part that's hard. It's the homeschool teacher that's hard.
I agree, Kelsey. It is hard with my 3 kids in 3 different schools and 3 different platforms. And yeah, it's definitely a true testament this for all of us.
I told someone the other day that I think 3rd grade's better than some of the college level classes that I'm teaching. So
I had my clinical groups when we do our little introduction each week, and I say one thing that they're thankful for, and I think it kind of helps. And one student said, "I'm just thankful for our technology." And I thought that was amazing because I think back to my own, when I was in school, there was no Dropbox or Moodle and Hangouts. And so I think we're very blessed for the technology that we have, that we can still stay connected. And we have a lot of resources that are online. And all the resources that we have, we've provided for our students were online that I wouldn't have had when I was in nursing school. So I think that's important too.
I would say too, the idea that we're being very intentional with our students who are often working in nursing homes or in places that they too have an added exposure risk. I think we're trying to be very intentional with their mental health, both in group aspects where we're checking in with them, but also talking one-on-one with students, really being available, knowing that, we're available to connect with them. I've been very intentional with some of my alumni that both work with me, but also that I know are working on other hospitals, in COVID, the step down units and things like that. New grads that, are brand new, fresh new grads in the ICU that I know are just getting hit with this, being very intentional about reaching out to those fellow nurses in the community that are our alum that I just feel are at a vulnerable state for being well. So.
All right. Well, yeah, thank you, Laura. Thanks to all of you. I think one last thing, we are also evaluating all this experience, like what has happened to us as people, as teachers, as practitioners in our different realms. I guess one last thing, if I could ask, do you have any piece of advice for the Bethel community going forward? I think, and it could be a variety of ways. I know we're certainly as faculty, we're figuring out, okay, it's likely there's some aspect of online coming in the future. What a piece of advice do you have for colleagues in that sense?
So one thing, I actually was going to mention this as a silver lining earlier and I forgot, but I've been really impressed that as teams, we have found some amazing resources out there to replace things that I think we probably never really thought that we could replace. And I think it was pretty early on, someone within our department had started a Google Doc of listing all these resources. And we have, I just think it has really expanded our creativity and been able to really look at these resources and figure out if they are good replacements for the in-person classroom time or lab time activities. And I think there's some things from this whole these last couple of months that I would really like to see used going forward for next year, whether we're on campus or not. I just think that within a team, we've been able to really pull some really great options and resources that we could use for the future. So, yeah.
All right. Well, anybody else before we finishing up? Or Amy, is there anything that occurs to you that we need to cover?
No, I just thank you to all of you. I think that it's a comfort and it's so cool as a fellow professor of a very different discipline to think of colleagues who are not only teaching, but really living out what they're teaching, and it's faith integration in a very nuanced kind of a way. And just especially the piece of being a parent too, because I think that's something I know that unites everybody that's on the screen here. And just to thank you for taking the time to do this, because this is actually really important in the midst of all of these other things that you're managing.